High Flow Nasal Cannula, HFNC therapy, is an oxygen-supplied system capable of delivering up to 100% humidified and heated oxygen at a flow rate of up to 60 liters per minute. Heat and humidified high-flow nasal cannula, or as most call it, high-flow nasal cannula, isn't just a standard nasal cannula cranked up to very high flow rates. It actually takes gas and can heat it to 37 degrees Celsius with a 100% relative humidity and can deliver 0.21 to 1.00% fraction of inspired oxygen, FiO2, at flow rates of up to 60 liters per minute. The flow rate and FiO2 can be independently titrated based on your patient's flow and FiO2 requirements. Heated and humidified oxygen has a number of benefits compared to standard oxygen therapy. Standard oxygen therapy delivered through a nasal cannula or another device such as a non-rebreather is cold, not warmed, and dry, not humidified. This can lead to airway inflammation, which can increase airway resistance or impair mucociliary function, possibly leading to a decreased secretion clearance. High-flow nasal cannula can warm and humidify gas, which can decrease airway inflammation, maintain mucociliary function, improve mucus clearance, and reduce the caloric expenditure in acute respiratory failure. To sum up how high-flow nasal cannula works, the following mnemonic is useful. H. It provides heated and humidifies gas. I. It can better meet elevated peak inspiratory flow demands. F. It increases functional residual capacity by delivering of PEEP. L. It is light and more tolerable than CPAP or BiPAP. O. It can minimize oxygen dilution by meeting flow demands. And finally, W. It provides high flow rates leading to washout of pharyngeal dead space and removal of CO2. Indication. The following are indications to use high-flow nasal cannula. 1. Acute hypoxemia respiratory failure. 2. Need for medium and high concentration oxygen therapy. 3. Support for intubation. 4. Post-extubation support. 5. Treatment and prevention of postoperative respiratory failure. 6. During intubation. 7. Patients with do not intubate DNI status respiratory failure. Contraindication. The following are contraindications to use high-flow nasal cannula. 1. No or low neurological response. 2. Abnormalities or surgery of the face, nose, or airway that preclude an appropriate fitting nasal cannula. 3. Post-CPR or respiratory arrest. 4. Hemodynamic instability. 5. Multi-organ failure. How to apply high-flow nasal cannula. You will be using 1. Nasal cannula interface. 2. Water chamber. 3. Heated breathing tube. 4. Oxygen connection tube. 5. The high-flow nasal cannula machine. 1. Install water chamber. 2. Connect water bag. 3. Connect heated breathing tube. 4. Connect the nasal cannula interface. 5. Connect oxygen tubing. 6. Connect to electrical outlet. Now you will need to be familiar with the buttons. 7. Turn machine on. Use mode button to choose temperature, flow, and oxygen supply. 8. Configure appropriate settings. To change the targeted setting, hold the up and down buttons for 3 seconds to unlock. Then adjust to the appropriate setting. Repeat each step for each mode as shown. 9. Turn on oxygen supply. 10. Confirm setting. Now it is ready for use. 11. Finally, apply nasal cannula interface to patient. Hfnc setting. Set flow rate first at maximum 60 liters per minute. Maximize the flow rate first in an attempt to keep the set FiO2 to less than or equal to 60. 2. Set FiO2 to targeted peripheral saturation. 3. Patient applied on Hfnc should be monitored for complications. Is high flow nasal cannula working or not? There is a risk for ineffective sealing of the passageways, leading to leaking of air and loss of the positive airway pressure effect. To check if it is working, ask yourself these questions. Is my patient's tachypnea improved? Is their work of breathing improved? Has their hypoxemia improved? Can I wean their FiO2 to less than 60% while maintaining their saturations? Signs of failure of high flow nasal cannula include additional elevations of respiratory rate, presence of thoracoabdominal asynchrony as early as 30 and 15 minutes after the beginning of high flow cannula therapy. 3. Failure to adequately improve oxygenation within 2 hours after the initiation of high flow nasal cannula.